Hi everyone, this is week 7, discussion number 7. And this week we were challenged to talk about a recent paper that we wrote, whether it be for work, school, or like for personal reasons, what our purpose was and who our audience was, and how we would describe our voice. So my most recent paper that I wrote was for this class, and it was a revision for paper number 4. My targeted audience was policymakers, mental health advocates, and members of the public who frequently encounter the homeless population in professional or day-to-day contexts. The purpose of my essay was to bring light to the fact that the majority of the people that are homeless have mental health struggles, and that mental health help isn't like readily available for people, and there's accessibility to like housing and like counseling, medications, all of those things are not available. And then as far as like defining myself and my voice, I'm a 34-year-old woman who is of Caucasian descent, but I have worked in public health for the majority of my career. It's been like 13 years that I've worked in public health. So I've seen how like mental health affects people and how hard it is for them to get help when they need it. And one of the examples that I used in my essay was of this woman. So I work kind of in the Beaverton area, and there was this homeless woman who was outside of my work, who obviously had some like mental health issues. There were times that she was like yelling outside at nothing. And she had like random signs on herself saying that people need to stay away from her, but she ended up doing like a violent act on somebody because people didn't help her, and you could tell that she was like really struggling and really needed help, but because a lot of the time our system fails at the people that need help the most, she didn't get the help that she needed, and she ended up having to go into jail, which is unfortunate. I feel like my voice was effective during that essay because I explained what integrative care could look like for people that are struggling with mental health issues. So providing like housing for them, providing access to mental health care, making sure they're getting the medications that they need regularly, and all of those kinds of things, so that we're not continuing to see all the issues that we're having, in the Portland metro area with all these people that are struggling and living on the streets, and all the crime that's happening because they're not getting the help that they need.